You are dispatched to a local construction site for a 48-year-old male who is experiencing chest pain during work. Please respond lights and sirens. The weather is clear and warm.
I understand that I am dispatched to a construction site for a 48-year-old male who is experiencing chest pain during work. BSI, is my scene safe?
Your scene is safe.
The nature of illness is chest pain. What is my number of patients?
You have one patient.
I'm going to request ALS assistance due to the nature of illness. I have a general impression of a patient that appears to have chest pain and is pale and diaphoretic. I would consider C-spine stabilization, but I do not suspect a need for it at this time. Hello, sir. I'm an EMT. What is your name and what did you call 911 for today?
My name's Mike Roberts, man, I'm just having some really serious chest pain today.
Okay, Mr. Roberts is alert and oriented. The patient is speaking to me. Can I assume that his airway is patent?
The patient's airway is patent.
How is my patient's breathing?
Your patient is short of breath and is breathing a little fast, but not rapid.
Okay, I'm going to go ahead and apply high-flow oxygen via non-rebreather. Mr. Roberts, do you mind if I touch you?
No, that'd be fine.
Okay. What is my patient's pulse?
The patient's pulse is strong and rapid.
Okay. And what is my patient's skin condition?
Your patient's skin is pale, cool, and clammy.
Do I see any bleeding at this time?
No bleeding noted.
Okay, I have determined this to be a high priority patient. I believe we should load and go as soon as possible. I'm going to have my partner take your vitals, Mr. Roberts, while I ask you some questions. Is that okay?
Yeah, that's okay.
Okay, great. So, Mr. Roberts, what were you doing today when all of this started?
I was helping unload a bunch of pipe out there.
Okay, and does anything seem to make it better or worse?
It seems like when I move around, it kind of gets worse.
Can you describe the pain to me?
It just really feels like something's crushing my chest.
Okay, like a heavy weight on your chest?
Yeah, exactly.
Okay. Can you show me where it hurts and anywhere else that it's hurting you?
Really just all up here, but even up in there.
Okay, so through the left part of your chest and then in your left arm. Can you rate your pain for me? 10 being the worst pain you've ever felt, 1 being no pain?
I don't know, maybe an 8 probably.
Okay, and about how long ago did that pain start?
35 minutes ago, I'd say.
Okay. All right, have you been experiencing any other issues today during this incident? Anything that we haven't discussed yet?
Well, right now I'm a little nauseous.
Okay, you feel like you might throw up?
Yeah.
Okay, well just keep me updated on that. Do you have any drug allergies?
I'm allergic to penicillin.
Okay, and do you take any medications and have you taken them today?
Yeah, I've got this nitro. I took one about 5 minutes ago.
Okay, and did that medicine help at all?
Yeah, a little bit.
Okay, all right. Do you have any relevant medical history, like why you take the nitroglycerin?
Well, I had a heart attack, and so I get the heart pain, that angina.
Okay, and what was the last thing that you had to eat or drink?
I had a bottle of water like 10 minutes ago or something.
Okay. All right, and has anything else happened today? Anything out of the ordinary? Anything relevant you can think of?
No, really not.
Okay. All right, so Mr. Roberts, I'm going to listen to your heart and your lungs. I'm going to push on your chest a little bit. I just want to make sure everything's working the way it should work. Is that okay?
Yeah, that's fine.
All right, so what I'm going to have you do is I'm going to have you lean forward, and whenever I put the stethoscope on your back, you just go ahead and take a deep breath for me. How are my lung sounds?
Patient's lungs are clear and equally bilateral.
Okay, and Mr. Roberts, just sit normal in your chair and breathe normal for me. I'm going to listen to your heart tones a little bit. What are my heart tones like?
Heart tones are found normal.
Okay, so I'm just going to push on your chest. Tell me if it hurts anywhere when I push.
No.
No pain?
No.
Okay.
Not like that.
Okay, so how is your nausea right now?
It's about the same.
Okay. All right. Do I note anything else during my secondary assessment?
No other findings.
Okay, and my partner's completed the vital assessment. What do I find those vitals to be?
Blood pressure is 160/88.
Okay.
Pulse rate is 102. Respiratory rate is 24. SpO2 is 97% on the non-rebreather. Blood glucose level is 101. Pupils are pearl at 4 millimeters.
Okay. Mr. Roberts, do you have or have you had any recent GI bleed, stroke, or asthma-related issues?
No.
Okay. So have you taken any erectile dysfunction medication in the last couple days?
No.
And you're positive it could cause some pretty serious issues if you have?
No.
Okay. All right. So I'm going to go ahead and give you aspirin. It's just regular old baby aspirin. You're just going to take it. There's 4 of them, and you just need to chew them up all the way. They're not going to taste great, but they do have some kind of orange flavor to them. All right, and Mr. Roberts, this is your medication, correct? The nitroglycerin?
Yeah.
Okay. It appears to be in date. I'm going to go ahead and ask medical control if I can give you some more of this. It might help with your pain. Does medical control give authorization to assist with administration of 0.4 milligrams of nitroglycerin sublingual to the patient?
Yes, medical control has authorized you to administer 0.4 milligrams of nitroglycerin sublingual up to a total of 3 doses for chest pain.
Okay. I understand that medical control has authorized me to assist in administration of 0.4 milligrams nitroglycerin sublingual up to a total of 3 doses. Is this correct?
That is correct.
Okay. Mr. Roberts, I'm going to give you 1 dose of this nitroglycerin. It's that same medication you took earlier. You're just going to put it under your tongue and let it dissolve. It could help with the pain, but it also could cause a little headache, and it might make your blood pressure come down a little bit. Do you understand?
Yeah.
Okay, go right ahead. Okay, so it seems the patient is experiencing cardiac-related chest pain. I'm going to reassess my patient every 5 minutes, and during my reassessment, I will assess level of consciousness, pain, and baseline vitals. What does my reassessment reveal?
Patient is alert and oriented. Pain is reduced to a 4 out of 10. Vitals are blood pressure 134/76. Pulse rate is 94. Respiratory rate is 18. Blood glucose shows no change.
Okay.
ALS have arrived on scene.
All right, so I'm going to give my verbal report to the arriving ALS unit. Patient is a 48-year-old male who is having chest pain and pain in his left arm. The patient initially had a pain level of 8 out of 10. Patient is also short of breath and had pale, cool, and clammy skin. The patient is allergic to penicillin with a history of MI and angina. The patient has a prescription for nitroglycerin and took 1 dose of 0.4 milligram prior to our arrival with some relief noted. We placed the patient on oxygen via non-rebreather at 10 liters per minute, and the patient does have clear and equal lung sounds bilaterally with normal heart tones and no pain on palpation. We did administer 325 milligrams of aspirin and 1 dose of nitroglycerin, 0.4 milligrams as authorized by medical control. And the patient noted some pain relief and states pain is now a 4 out of 10. His last set of vitals is a blood pressure of 134/76, 134/76, a pulse rate of 94/94, respiratory rate of 18/18, a blood glucose level of 101/101, and pupils are pearl at 4 millimeters. Are there any questions?
No questions from ALS unit. Is there anything else you would like to do?
No, there is nothing else I would like to do. I'm done with this skill.